As we look back across the decades in Kenya, we have witnessed some remarkable changes. More couples are using family planning, with use of modern methods increasing from 15% in 1989 to 53% in 2014. More children are surviving, with child deaths dropping from 89 per 1,000 births in 1989 to 52 per 1,000 births in 2014. Our economy is growing, with income rising from 120,000 Kenya shillings per person in 1993 to 240,000 Kenya shillings per person in 2013. And we are better connected, with about 32 million subscribers using cell phones today. We are a nation on the move. But there is one challenge where we are sadly behind. Malnutrition in mothers and children, which continues to impose a staggering cost to the nation, despite having the solutions. As of 2014, malnutrition contributes to the deaths of more than 35,000 children under the age of 5 each year in Kenya, or about 1 out of every 2 child deaths. One of the indicators of malnutrition, which we're going to talk about today, is called stunting, when a child is shorter than normal for his age. Stunting happens over time and can be caused by inadequate maternal nutrition, poor feeding practices, or substandard food quality, as well as frequent infections which can slow down growth. So, what has the experience and research on nutrition programs taught us over the years? Well, the story starts in the 1,000-day window of opportunity between pregnancy and a child's first 2 years. This period becomes the best shot at helping a child reach his or her potential and sets the stage for life. Let's take a closer look at just how critical this period is. Starting in the womb before birth, the fetus is at risk if the mother lacks essential vitamins, minerals and nutrients needed for brain, bone and organ development. More than half of all women in Kenya suffer from anemia during pregnancy, which can cause health problems for the baby. Once the baby is born, from birth to the first 6 months, early and exclusive breastfeeding without adding any other foods or liquids is the very best way to ensure a healthy baby. And after the first 6 months of life, adding sufficient quantities of nutritious solid foods along with continued breastfeeding is absolutely necessary to make sure that the child grows correctly. Most stunting happens in this critical period. There is no going back. The cost of malnutrition during this 1,000-day window is almost always irreversible. Damage to the brain, leading to poor educational performance and lower IQ, poor growth and development, and surprisingly, this early deprivation increases a child's risk of developing chronic diseases as an adult. Chronic diseases like diabetes, high blood pressure, and heart disease that will require continued medical attention and care later in life. Another huge challenge is that malnutrition can happen and persist for years, and we can't always see it. These 2 little boys are both from the same village. Can you guess how old each boy is? Both boys are the same age. They are both 8 years old, but they show very different levels of development. The little boy on the left is stunted owing to poor nutrition, and it's unlikely that he will ever catch up and reach his full height or his full potential like his taller village playmate on the right. The invisible nature of chronic malnutrition sets up a pattern that we see happening generation after generation. This intergenerational cycle of growth failure starts with a malnourished woman, like this mother who is at a greater risk of complications during pregnancy and childbirth. She also has a greater risk of delivering an infant with low birth weight, like this baby girl who is at higher risk of illness and death and at higher risk of delayed emotional and intellectual development. And she is also likely to suffer from growth failure in those important early developmental years, which in turn lead to low weight and stunting in the teen years, Those teen years that are critical for growth and development, and the time when adolescents gain almost 50% of their adult body weight and 20% of their adult height. And that takes us back to our malnourished women. And the cycle of poor nutrition continues generation after generation. Adolescent pregnancy also increases the risk of low birth weight and adds to the difficulty in breaking the cycle. Unfortunately, we see this cycle of growth failure happening over and over with families across the country. Turning now to our Google Earth satellite map, we're going to zoom in on Kenya and start our tour of the country coming into the bustling city of Nairobi. You may recognize the Kenyatta International Conference Center, or KICC, on the left side of the screen. As we travel a little to the west of KICC, we find ourselves in the middle of Kibra, a densely populated informal settlement with poor living conditions. Here, malnutrition affects the lives of most families, with more than half of children stunted. Although the rate of malnutrition definitely increases with poverty, it is not a problem that is unique to the poor. For instance, as we fly over one of the wealthy suburban areas in Nairobi, with its lush green trees, big houses, and large swimming pools, it is easy to assume that children who live in wealthy areas do not suffer from malnutrition. How could there be malnourished kids in this neighborhood? Yet, about 14% of children born to rich families in Kenya are also malnourished. Clearly, malnutrition can affect all children, regardless of social or financial status. As we travel outside of Nairobi, we discover that, similar to the wealthy suburban neighborhood, malnutrition continues to have a strong presence in the most unlikely areas, like here, in the western region of Kenya, where the abundant rainfall supports the farming and agricultural industry, which serves as the main livelihood for most residents in the area. But despite the abundance of food, including nutrition-rich fruits and vegetables, malnutrition is widespread here as well, with more than 1/4 of children stunted. It is clear that wealth and geography are not enough to evade the expansive reach of malnutrition. So how is Kenya doing in reducing malnutrition? For several years, the rate of chronic malnutrition, or stunting, stagnated at around 35%, but a 2014 survey revealed that we are making progress. Stunting has now dropped to 26%. Although chronic malnutrition is decreasing, about 1 in 4 children under 5 still suffer from stunting. The big news is that the exclusive breastfeeding rate has dramatically improved. In 2003, only 13% of children under 6 months were exclusively breastfed, which rose to 32% in 2008. But by 2014, 61% of children under 6 months are exclusively breastfed. Quite an achievement. Unfortunately, we have not seen the same positive gains in other areas. For instance, according to the World Health Organization's recommendations, after the 6th month of life, children must be fed a variety of foods to make sure they receive all the nutrients they need. But the most recent national survey shows that 4 in 5 children are not receiving the right foods. Many are eating only starches, and they are not eating those vitamin-rich fruits and vegetables or animal source foods like meat, fish, and eggs that provide the body's basic building blocks. But making progress is possible. We know we can overcome these challenges because we know what makes a difference. 5 well-tested sets of interventions can protect mothers and children, beginning with ensuring that pregnant mothers receive vital micronutrients such as iron and folic acid, which can increase the likelihood of a safe and healthy pregnancy. Secondly, making sure that babies are put to the breast the first half hour after birth and are breastfed exclusively for the first 6 months. Thirdly, that mothers start giving a variety of healthy foods after the first 6 months of life in sufficient quantities, along with continued breastfeeding through 2 years and beyond. Next, we need to ensure that mothers and children have access to the right amount of foods and the right variety of foods, and that they have access to foods rich in vitamins and minerals, and they are consuming those essential vitamins and minerals regularly. And lastly, making sure that parents and caregivers get information on improved feeding and healthcare practices and the support that they need to feed their children in the best way possible. Research shows that nutrition investments are a best buy in today's financially strapped environment because investments in nutrition pay for themselves. Healthy nutrition during the 1,000-day window produces a lifetime of benefits for individuals, families, and nations, and that includes producing stronger football players. Healthier children complete more years in school and have better performance, which leads to increased personal income and can add at least 10% to lifetime earnings. Since healthy nutrition in the 1,000-day window can increase educational performance, well-nourished children grow into a more productive labor force as adults, and that can mean a boost in GDP growth by as much as 11% annually for the country. And if we look at the cost-to-benefit ratio, the cost of key nutrition interventions compared with the savings investment in nutrition produces returns of up to 16 times greater than the initial investment. In other words, for every 100,000 Kenya shillings spent on key nutrition interventions, we would generate 1.6 million Kenya shillings in economic returns. In fact, scaling up vitamin and mineral interventions alone could add more than 200 billion Kenya shillings to the GDP each year. So scaling up nutrition interventions can go a long way toward generating broad-based wealth. Malnutrition is a national problem. Finding solutions must be a shared responsibility. We ask that you speak out and help us advocate for reducing malnutrition in your communities and constituencies, drawing attention to the urgent nutritional needs of pregnant women and their unborn children, and to the importance of community programs to support appropriate nutrition practices. We ask you to ensure that key nutrition interventions are integrated into development strategies across all sectors, including treasury, education, devolution and planning, agriculture, livestock and fisheries, and environment, water and natural resources. We ask you to help mobilize more funds for nutrition interventions from government. Specifically, we need increases for nutrition in the budgets for the Ministries of Health and Agriculture, and we need to establish explicit budget lines devoted to nutrition at the county level if we are serious about making a difference with malnutrition. And we ask that you help us coordinate programs and policy efforts for nutrition among the different ministries and stakeholders. One first step is to support the current nutrition coordinating group headed by the Sun Civil Society Alliance to better ensure that all nutrition interventions mutually support and reinforce one another. We can't afford to lose any opportunities. By investing in simple, cost-effective interventions like appropriate maternal, infant and young child nutrition practices, we can ensure that every child reaches his or her full potential, reduce illness and deaths in mothers and children, and help ensure stronger economic growth in the future. By staying positive and working together, We can build on our past achievements. We can scale up nutrition for those most in need. And we can wipe out malnutrition in Kenya once and for all. Nutrition is key. Take up your role. Act now.